Hello, good evening. It's Dr. Chudi Ufondu of Snowspirations Global Health Solutions. It's been a very wonderful time sharing my knowledge and my experience as a medical practitioner in maternal and child health, and especially my experience and my word of knowledge in the area of defeating infertility. It's my belief that every woman is a mother unto proven otherwise. It's my belief that every man is a father, and sometimes we have challenges in life, just like every other thing. We encounter challenges in life, but that doesn't mean we're not going to become who God said we're going to become. But this evening, I wanted to quickly talk about bleeding in pregnancy. And so many women wonder if they can still have their period when they are pregnant. And I'm just going to make it very simple so you will understand. Everything related to pregnancy is unique. So there are a couple of things that happen when you're pregnant. I'm going to use my teaching model to kind of demonstrate. I love this. This is the secret of everything we do. So when you become pregnant, there are a couple of changes that happen inside the womb. So this is the womb. This is the almighty womb. This is where your baby develops. This is the cervix. So the cervix is the junction between the vagina. So this is the vaginal lumen. So this is where the penis will come in. And at the peak of sexual intercourse, they will deposit the semen, which contains the sperm. Then the sperm will permeate through the cervix, get to the womb, then decide if it's going to go to this direction or this direction to get to the tube. So this is the tubes. This is one of the tube. This is another tube. This is the ovary. This is another ovary. Now, when you're pregnant, there are physiologic changes inside the womb. So physiologic changes means how your body is structured to change when you're pregnant. Once you are confirmed pregnant, there are a couple of hormones that maintain pregnancy. In every woman, there are reproductive hormones that will make sure you perform your role as a woman. So I'm going to mention a couple of them. Number one, your estrogen. Estrogen is very important. So estrogen is one of the hormones that actually makes sure you're a woman, you perform all your duties, you actually play the full role of a woman in your reproductive phase in life. Your reproductive phase is when you have the ability to have your own kids. Every woman has more like sleeping eggs in the ovaries. So your ovaries contain the eggs in the immature stage. But every month they mature through the process of ovulation and they are released. Now, when you become pregnant, besides the estrogen, there is also another important hormone we call progesterone. Then there's another important one we call FSH, follicular stimulating hormone. Then we have another important hormone we call the LH, luteinizing hormone. Then we have the prolactin, then we have the thyroid stimulating hormone. But these are the key hormones that will play a role in your body before you become pregnant. So here's the deal. When you become pregnant, everything related to releasing the egg through any of these means will cease. So you're no longer going to ovulate. That particular egg you release will be fertilized somewhere in the tube called the ampulla. Once that fertilization occurs, you have been confirmed pregnant. Now, every singular thing that leads to your normal bleeding in the month will cease. So there is nothing like bleeding when you are pregnant, because the hormones responsible for you to bleed. Matter of fact, when you bleed in a month, is actually the womb weeping. So the essence of bleeding is the breakdown of the cover of the womb, which was thickened to prepare the womb for welcoming the baby. But when there is no fertilization and you don't have any baby developing in the womb will break down. This is pretty much what happens during your menstruation. So you bleed, it's passed out. But when you become pregnant, the cover of your womb will be thickened. That's called the endometrium, to support the pregnancy. One of the hormones that actually leads to good support of pregnancy is the progesterone. When you have adequate level of progesterone, your pregnancy will proceed properly. But when your progesterone level is low, you can actually miscarry that pregnancy. So conventionally, once you are pregnant, you're not supposed to bleed. All bleedings in pregnancy must be treated as abnormal until proven otherwise. Some women can have what we call implantation bleeding. So when the fertilized egg comes down to start developing in the womb, you can bleed, just minor light spotting here and there. That's called implantation bleeding. Completely okay. But if you are pregnant and you notice you're bleeding, it's actually a danger sign. There are a couple of things we don't want to see in pregnancy. Bleeding is number one. Water coming out of your body, which is PPROM, premature rupture of water membrane. We don't want that. Pain anywhere in your reproductive system. We don't want that. So pain, bleeding, and water coming out of your body might be a sign you are losing that pregnancy, which is called miscarriage or abortion in medical practice, which is the unintended loss of your pregnancy before 20 weeks. So these are simple, important things you have to be conversant with. So the concept of, oh, my friend told me, my sister told me she was pregnant and she was still bleeding, it doesn't happen. It's completely abnormal. So if you're pregnant and you notice you're spotting or bleeding, please ring your doctor and go in immediately for examination. Now, here is the good news. So many pregnant women will bleed, but that doesn't mean they won't give birth to their baby. So many pregnant women will bleed, but if we attend to them properly and if we can manage the bleeding, they can still go ahead and have their babies. But don't neglect any form of bleeding, because the earlier we investigate, assess, and find out why that woman is bleeding, the better we can begin to apply preventive measures. Okay? So categorically, bleeding in pregnancy is abnormal. It's not normal. When you experience that, report to your doctor immediately. Now, as a rule of thumb, once you notice bleeding in your pregnancy, suspend stress, suspend sex, and suspend stress. 3 S's. Stress, sex, and sports. The third one is sports. So no sports, no strenuous activity, no sex, and no stress. If you can observe a triple S's, then the likelihood you're going to have good outcome is very high. But this, in a nutshell, is what you need to know about bleeding during pregnancy. So I want you to be very conversant with this female reproductive system. Very, very beautiful structure. Every woman in my group is expected to know this. The better you understand this, the better you can understand your health. Thank you for watching today. God bless you and enjoy the rest of your evening. Bye-bye for now.